My name is Margot Dunlap, and I'm the Program Coordinator at the Johns Hopkins Endoscopic Weight Loss Program. I'm here today interviewing Dr. Vivek Kumbhari, the Director of Bariatric Endoscopy at the Johns Hopkins Medical Institutions, and Dr. Lea Fayad, the Postdoctoral Research Fellow and first author of the paper. We will be discussing the recently published paper in GIE study, Endoscopic Sleeve Gastroplasty versus Laparoscopic Sleeve Gastrectomy, a case match study. We would like to thank GIE for the opportunity to discuss this. Dr. Kumbhari, can you explain more about the endoscopic sleeve gastroplasty?
Certainly. So the endoscopic sleeve gastroplasty is a transoral or flexible endoscopic procedure whereby the apolar overstitch endoscopic suturing system is attached to a therapeutic double-channel Olympus gastroscope and inserted through the mouth into the stomach, and the sutures are used to essentially refashion the stomach and take the stomach from a usual 100% of size to a non-compliant sort of banana-like sleeve-type lumen, which is about 30% of its original volume. It takes anywhere between 60 to 75 minutes. You use anywhere between 6 to 10 sutures, and patients go home the same day. Importantly, there is no tissue that's actually removed with this procedure. It is simply involuted.
Why did you feel a need to do the study?
Well, patients with obesity are increasingly educated about their treatment options, and one of the most common questions they ask us is, how does the endoscopic sleeve gastroplasty compare to the laparoscopic sleeve gastrectomy and other standard bariatric surgical procedures that already exist? The assumption is among patients that since the ESG reduces the size of the lumen of the stomach to that similar to that of the LSG, that weight loss outcomes should be similar. And this is attractive to patients because it is a minimally invasive procedure. However, when they ask us this question, we cannot answer with certainty because there is a paucity of research that has compared the ESG to the LSG. And thus, this inspired us to perform a study comparing the two procedures.
How would you summarize your study and findings?
What we did was a retrospective review of a prospectively collected database of ESG patients and of LSG patients here at Johns Hopkins Medical Institutions. We case matched 54 ESG patients to 83 LSG patients based on age, sex, and BMI. And we looked at their weight loss outcomes at 1 month and at 6 months, calculating the percent total body weight loss. We also looked at adverse events, and we looked at the development of new onset GERD, or gastroesophageal reflux disease. What we found was the percent total body weight loss in the ESG group was significantly, in fact, lower than that in the LSG group, at 17.1% as compared to 23.9% in the LSG group. However, we also found that the adverse event rate was significantly lower in the ESG group than that of the LSG group, at 5.2% as compared to 16.9%. And finally, when we looked at new onset GERD, we found that ESG group also had a significantly lower rate of new onset GERD than the LSG group. So at 1.9% as compared to 14.5% in the LSG group. And those two groups did not have a significant difference in their initial baseline rate of having GERD.
What does your study add to existing knowledge, and what is unique about this study?
So one of the things that's unique about this study is that the fact that it is a case-matched study. This is the first case-matched study to compare the two procedures to each other. And that's important because these patient populations often differ significantly at baseline. So controlling for those factors is very important to us. In addition, the fact that we looked at new onset gastroesophageal reflux disease is important to us because in the bariatric surgery sphere, there is concern about development of gastroesophageal reflux disease after laparoscopic sleeve gastrectomy. And this was important for us to explore in our study and look at whether there is a new onset development of GERD in the ESG population as well. And from our current data, it seems that there is significantly greater new onset GERD in the LSG group as compared to the ESG group.
What should come next, Dr. Kumbhari?
Thank you. This study is particularly interesting, and not only does it provide important data, I think it provides an opportunity to extend and sort of decipher really the differences between the ESG and LSG group. Now, our group here at Hopkins, we're very interested from a translational perspective in terms of understanding these differences, such that we can develop new methods of weight loss that may not simply be restrictive in origin. I think with regards to what goes from here, we know that it's important to study ESG in a prospective manner, and there is a study headed by the Mayo Group comparing ESG to diet and lifestyle, and this will be a very comprehensive study with very important outcomes. And although that's several years away, we do think that will provide robust data which will help really guide our patients. The second thing is that it's rather interesting that our study did elicit a significantly different total body weight loss between the two groups, despite the luminal capacity being somewhat similar between the two procedures. So it makes us think, why is it that despite two stomachs having the same shape, that there is such a significant difference, not only in weight loss, but in reflux? You would presume that both of them would be the same. And there are several hypotheses that can be drawn with regards to this, such as the importance of the gastric mucosa and sort of the pressure dynamics of an ESG versus an LSG with regards to the propensity for reflux. So I think this is an important study. It really sets the benchmark for a lot of potential future studies which will help answer more questions regarding bariatric procedures, either endoscopic or surgery, the mechanisms of actions, and provides insights into how we can better inform patients as to expected outcomes.
Thank you. Thank you, Dr. Kumbhari. Thank you, Dr. Fayad. And thank you, GIE. We look forward to any correspondence that you may have about this recently published study.